There is a growing number of patients suffering from disorders of the GI tract. From gas, acidity, after ulcers, gastritis, Crohn's disease, ulcerative colitis, irritable bowel syndrome, diverticulitis, piles, constipation, to cancers of the mouth, food pipe, stomach, intestine, and anus. The numbers are increasing. New studies shows that the changes in food habits and lifestyle are the cause of this increase. GI-related disease usually begins with the symptoms like discomfort, pain, gas, acidity, nausea, vomiting, constipation, blood in stool, etc. When these symptoms are evident for prolonged periods, it often results in ulcers and cancers. Usually, by the time the cancers are diagnosed, it may have already spread. At a late stage, even with the latest treatment of surgery, chemotherapy, radiation, and immunotherapy, less than 10% of the patients survive beyond 5 years. When symptoms are seen and the reasons explored and rectified in most patients, it is possible to prevent progression to cancers. Let us understand how to overcome the discomforts, reduce the need for medication and surgery, and prevent the progression to cancer. And for those suffering from cancer, how to overcome and prevent recurrence. Health tips are not the focus here. Rather, the effort is on providing information that will help to understand the causative factors behind the health condition, measures for early detection, tests to assess the current status of the disease condition, present treatment options in modern medicine with the benefits and limitations. Also, I will try to convey the fundamental relationship of this health condition with the lifestyle and impact of correction of lifestyle has on reversing and preventing recurrence of this health condition. This is why the video may appear long. To help you save time, we have time-stamped the topics in the description below for those who prefer it. Here the focus is on those who would like to make more informed decisions on matters concerning their health. This is important, especially when they would like to avoid surgery and chronic medication with the added effort from their part. It should be remembered that those who are on medication should reduce or stop medicine only under medical supervision. To understand the problems of the diseases of the gastrointestinal tract, first we should know how it is made and what is the function. We all know that the gastrointestinal start from the mouth and end at anus. So whatever food we are eating, we are chewing it, and then comes into the esophagus, that is the food pipe, and then it is reaching the stomach where it is stored, and it is actually made into a syrupy sort of thing. To some part of digestion is happening in the stomach itself, and then it's a partially almost this grinding process is happening in the stomach, and then it is going into the small intestine. Small intestine is the place where that micro changes are. That is, the macro changes happens in the stomach, and the chemical changes, and it is actually the food is degraded. The carbohydrate is converted into plain sugars like glucose, and the fat is converted into triglyceride, and even the protein is converted into amino acids, because due to the action of the enzymes, and it is ready for absorption, and a very good amount of absorption takes place in the small intestine. And it has two parts actually it has three parts. The first part is called duodenum, in where that liver juice or the bile and the pancreatic juice comes and join with the is released into the intestine, that is at the part of the duodenum. Then the jejunum comes, and then the ileum. All these parts has different actions actually. Then there is the junction point is there. That is also some dilatation. The storage space is there. That is called a cecum. Then this large intestine start, and the cecum, that actually cecum, we know that the appendix, many people undergo appendicectomy because of the infection and all. This appendix is also at the part of the joining portion, that is from the cecum. It is it's a small projection actually. Then it is the ascending colon. Then the stomach is ascend. That is a bigger ascending colon. Colon is some more small intestine is small, diameter is small, and the large intestine is the more bigger actually. That is actually it has an ascending part, then a transverse colon, then a descending part. And descending part entered the rectum. That is again a storage space where the waste that after all the changes and absorption and digestion, it is the waste is collected in the rectum. And anus is the opening actually. So when it is stored there, and when it is everything convenient, time and place is convenient, you feel that you get the feeling, and you can open the door and waste is removed. Actually, this liver and gallbladder and pancreas also a part of the digestive system. The food which is absorbed from the stomach, actually some amount of absorption starts from the mouth itself. We know that there are many medicines we are keeping under the tongue. If you want to improve the fast effect, you put the sublingual tablets are especially for the heart attack. When you get a cardiac pain, angina patient, you apply a tablet at the below the tongue, and it gets absorbed, and you get the faster result. It's just like injecting into the blood, just like an injection, IV injection. Some small quantity of medicine can be absorbed very fast. So actually the absorption starts from the mouth itself, but major part is from the small intestine and the colon actually. So after this absorption, the blood with this high content of nutrients comes directly into the liver. So there is a special circulation, that is liver has a special blood circulation pattern. Just like any other organ, it has arteries, that is the oxygenated blood coming, and the vein, which is this after removing the nutrients and all the waste is collected through the vein, it is going up. That is called hepatic arteries and hepatic vein. But there is another sort of circulation also happening in the liver, that is called a portal circulation. All the food which is digested in the stomach, small intestine, large intestine, etc., absorbed into the portal circulation, and this is coming into the liver, and it is again distributing into the liver. This blood is, and finally the whole blood is drained back in with the hepatic vein, goes into the heart or inferior vena cava, and then to the heart. That is very specific about it. And even the pancreas also connected, and the pancreas and from the liver, this bile, that is a digestive juice, that is very essential, and also it contains some waste material also. It comes, and liver is always producing that, and the gallbladder is a storage space, and it is coming into the gallbladder, And from the gallbladder, when you eat food, these enzymes, enzyme rich, that is digestive enzyme rich juice, bile juice is released into the duodenum, that is the first part of the small intestine. That is actually depends on the how much food you eat and when it is. For that, till if it is tricking, it is may not be good. That is why it is the gallbladder is there, and the pancreatic juice also comes into the same common bile duct and opens into that. So, if you are removing this gallbladder, so actually you are that opportunity of one storage space you are removing. So we should be very careful about removing, because any problem comes for the happens any disease of the gallbladder is a problem with the liver also, or the whole intestinal tract also is involved. So if you are just, we are saying so small few stones in the gallbladder, you should, it is easy to remove any organ. It's a surgeon's job. If you are just like any other profession, the doctors, especially the gastrointestinal surgeons, can easily remove. It's a complicated and so many intrasurgical and on the table anesthesia problems and all can come, but it's a removal is an easy part. Now even the endoscopic surgeries are there, it's easy part, but you cannot make a gallbladder. So whenever you see a problem with the gallbladder, correct it. Try to correct it, because it is the calcium. The stones are developing because of the quality of that bile. So the quality of the bile depends on the liver. So there is a problem. You should understand that if it is a problem with the stone is happening, it is a disease of the liver. And also the polyp or the cancer of the gallbladder also of the same nature. So whatever is, if you are any of these organs are troublesome, you should think about all these organs, not the just focus on the gallbladder, just focus on the liver, fatty liver. So only after a few years of fatty liver, this gallbladder problem starts. So we should be really sympathetic to these organs before you are deciding on removal of such organs, because they are all beneficial for the body. Next is how this movements you are eating, and it is going through the finally it has to be removed from the anus. How this movement happens? Actually, it is you have the control when the food is in the mouth. You can chew it, you can taste it, but once you swallow it, it is out of your control. So till the mouth, it is under the skeletal muscles, the voluntary control is there. But after that, it is the control of the enteric system. That is the smooth muscles. It's the muscles in the esophagus and the intestine, small intestine, large intestine, stomach, everything is of a smooth muscles actually. The skeletal muscles, that is of the jaw muscles and the tongue, everything you have control. But other things is you don't have any control. It is controlled by the autonomic nerve system. That is, it has two parts, sympathetic and parasympathetic. So it is sympathetic has some action. It is actually sympathetic and parasympathetic is working in an opposing manner in a way, and its action is actually controlling. And this for the sympathetic and parasympathetic, sympathetic nerves is coming from directly from the nerves from the brain itself. There are 12 cranial nerves, out of which the vagus nerve is there. That is actually the parasympathetic nerve, which is giving give all the internal organs actually this involved, that they have a sensory and motor action is there. So, and also from the sacrum, also sacral nerves is 2 and 3, also some parasympathetic. We are generally more in medical field, we call it as craniosacral outflow. But the sympathetic, that is, there is a parallel to our vertebral column, there is a sympathetic chain, and there are celiac ganglion, solar plexus and all. There are some special forms of nerves are there that is actually supplying the sympathetic aspect of the autonomic nerve system. These are actually giving the sensation, this sympathetic and parasympathetic both have the motor. That is, the motor means it is acting on the muscle. So there is smooth muscles and they have peristalsis. Actually, the food is moving through the intestinal tract to the peristaltic movement. After, when you swallow, it's the esophagus muscles start functioning and it propagating the food to the stomach, and from the stomach there are other photos, chewing and grinding process is happening. Then slowly it is released into the, but it's actually it is not just going like that. It just as bouts, just as swallowing each bouts. It is also after the stomach is grinding part is over, it also will be released into the intestine. Small bouts actually. And the most important thing about this nerve supply of the intestine, other than this sympathetic and parasympathetic, there is one more system called enteric nerve system. That also starts from the throat or after swallowing from the upper part of the esophagus to the anus ending. So this enteric nerve system, there is these nerves are between the mucosa, that is the inner covering, and there is two layers of longitudinal and circular muscles are there. In between that is nerves are there. Actually, they are controlling this peristaltic movement and all, and it is connected to the brain final central control with the sympathetic and parasympathetic system, this vagus nerves and other autonomic nerve system. So all these are the interplay of all these is very important for the digestion, absorption, and bowel movement, etc. And any disease happening in the intestine, this nervous system also is involved. And also there are so many hormones produced by the intestine itself, intestinal lining. There are control mechanism and so many chemicals produced by the stomach mucosa and also the intestinal mucosa, and also many enzymes. So and also hormones, glucagon. So many are there. Previously, we were not aware of many of the hormones. We were knowing only the few endocrine glands only. But now we know there are so many hormones produced by these things, and which is controlling, in fact, the central control. That is, we have the pituitary and the hormonal glands in the brain. They are indirectly controlled by these peripheral hormones actually. Next we come to what are the diseases happening with this our digestive system. Basically it starts from mouth, and we know that the aphthous ulcer, the ulcers forming in the mouth, it is a problem for many. And also the dental problems, dental caries, and the gingivitis. Actually, all these are connected with our food and nutrition also. And then when you come to the esophagus, it is the GERD that is very common. Gastroesophageal reflux disease. And most of these patients with the gastrointestinal reflux disease, when we look into an endoscopy and all, it is very common to see that a hiatus hernia, that is some herniation of the stomach is happening. Actually, this from the lower part of the esophagus is penetrating the muscle called a diaphragm. Actually, the diaphragm is a muscle which is separating the chest cavity, which contains the lungs and the heart, and the intestine and liver and all from the abdominal cavity and the chest cavity. And there is a opening, or there is a hole through the one of the canal or the hole. This stomach is this esophagus is coming down, and if that is weakened, this some part of the stomach can go up. So actually it is a door, there is a sphincter, and also this part is acting as a extra strength to the door actually. So when this door is weakened, this hernia is occurring. That is the reason for most of the cases this GERD or gastroesophageal reflux. That is actually simply the fluid in the or the food and the partially digested food mixed with the hydrochloric acid, that is an acid, very strong acid actually, and it is entering into the esophagus. So it is creating problem. That is actually this heartburn, and even it can come to the mouth itself, and it can create caries, and even many of this even tooth decay and all happens because of this reflex gastroesophageal reflex disease. And then the stomach, when we come to the stomach, it's in a particular nature of this is actually acidity. Actually, it is acid. Acid is secreted by the stomach, which is actually very important for the digestion and even for the protection. When any bacteria, virus, or anything happens in our food, it is if you are taking that, then the stomach has this. When it is mixed with the acid, very highly acidic medium, they all will be destroyed. But if the acidity is low, then they can survive, and we can get food poisoning and other diseases also. And if there is some infection happens also, this acid, because of to protect, to get out of this infection, the stomach can produce more acid, and that is actually in terms making this ulcer. We are always calling ulcer acidity and all. And there is the reason we know that there is a relation with the H. pylori infection also. This H. pylori infection produces more acid, and it goes to ulcer, and it's a cycle of events happening in that. But the problem is what we are now treating is with the antibiotics and all. We'll try to reduce the H. pylori, but definitely it will regrow. That is what is we are saying. And if the H. pylori infection is there, or maybe this H. pylori itself will be coming because of there is some immunity problem is there. Actually, this acid secretion, it's also an immunological. It is the immune system is doing all these things. There is a weakening in that. So such patients can have the cancer possibility is high. Next is small intestine. What are the diseases affecting the small intestine? Actually, it is mainly malabsorption disorders. We call that's a lactose intolerance, those who cannot tolerate milk, fructose intolerance, those who get discomfort with taking fruits. And there is another form of carbohydrate called sorbitol intolerance. The sorbitol is there in many of these. It is actually a sweetener. It's a food additive also, and also many of the medicines, syrupy medicines also. So they may have problem with the sorbitol. If you have sorbitol intolerance, they may have problems while taking those things. And the celiac disease, that is gluten intolerance. This gluten is a protein which is in the wheat, oats, and rye, and such as some this sort of cereals. And if you take the gluten, this gluten-rich food like this, it is actually your intestinal cells, that is absorptive cells, will be destroyed, and the absorption will not happen. So the patient will be getting all sort of discomforts and even weight loss and stomach problem, and that is celiac disease. If the gluten is producing intestinal problem, it is called a celiac disease. But the gluten, that is the major protein of the wheat, can produce other problems also, like gluten ataxia, when it is affecting the brain, that is especially the cerebellum. Cerebellum is actually controlling your balance and all. If such nerves is affected, you can get gluten ataxia, and also it can affect the cardiac nerves. And cardiac nerves, it is affected. Muscles also will be get affected. Cardiac myopathy and wheat allergy, definitely the immediate sign of wheat itching, and when this intolerance is immediate and it's visible, we call it as allergy, because itching and wheal formation and all. But if the intolerance or the allergy is delayed, and we may not get any evidence signs, but only we look into the details and or by the testing and all, we can understand that it is. And the speciality of these sort of gluten, celiac disease and all, if you avoid gluten in your food, you will be able to recover. And the latest studies shows that actually this non-celiac gluten intolerance is have an important role even in the psychiatric disorders. If you can damage the cerebellum and make you ataxic, or the balance problem can occur, definitely it can affect other nerves also. So whenever if you are in a problem, especially in type of autoimmune disease, may not be having much problem with the intestine also, you should think of using a gluten-free diet. Next is IBS, that is irritable bowel syndrome. Actually, it is the overactivity or underactivity of the gut-brain interaction. Actually, it's a neurological problem. This IBS people, some may get abdominal pain, bloating, and diarrhea, or even constipation. And it is happening mainly because of the patient is observing it when they are stressed, or also with the certain food, and also with some hormonal changes, like ladies before menstruation or with the menstrual cycle, there can be changes. That is actually this disorder of the gut, this enteric nervous system, and its connection with the brain. It's a neurological problem mainly. Next, when we come to the colon, that is the large intestine, the constipation is the major problem, and also the gas. The motility of these movements can be affected. It is also because of the nerve or muscle action. Now, if the nerve is affected, the muscle can get weakened. So, if the diarrhea occurs, means the bowel movement is increased, or if the constipation is there, the bowel movement is decreased. So the movement is not happening properly. It is definitely, it has a role of the nerve system and also the muscle. The muscle can act only if the nerves say. So if the nerves is affected, it will damage the muscles indirectly. Small intestinal bacterial overgrowth, SIBO, is actually one of the reasons for the abdominal pain, bloating, and diarrhea. The overgrowth and undergrowth. When we think of the microbial flora, next another disease actually affecting the intestine is the IBD, that is inflammatory bowel disease. IBS is irritable bowel syndrome. This is IBD. It is the inflammatory bowel disease. That is actually mainly Crohn's disease and ulcerative colitis. Crohn's disease, that is inflammation and abscess formation and all, it can affect any part of the intestine. That is even the mouth, or the esophagus or the stomach and any part. The ulcerative colitis is another form of inflammation. It is mainly affecting only the colon, that is the large intestine only. And another thing is diverticulosis. That is actually, it's a nerve and muscle disorder. When the nerve is damaged, that part of the muscle is damaged, then small ballooning or a diverticula is formed actually. So we should understand that this basically this inflammatory bowel disease is forming ulcers. So the intestinal integrity of the mucous membrane, just like our external skin, the internal protective coat is the mucous membrane. There is ulceration in that, as you just like an ulcer on the skin. When the ulcer comes, the bacteria and virus, we all know that when a wound is there, the getting infection is the problem. So just like that, when you get an ulcer, even it's a mouth ulcer, that is a part of this sort of inflammatory disease. After ulcer is a part of most of the patients with this mouth ulcers, they may be getting this intestinal ulcers also. So we should be very careful about such abscesses or ulcers, because it is actually giving an entry for the bacteria and the viruses, all these microbes into the system. So they will directly go into the bloodstream, and the impact will be mainly happening on the liver. Actually, first it is going into the liver, and the liver, if they are not able to, the liver special sort of immune cells are there called Kupffer cells and all, they will catch this and try to destroy it. But if they are not able to, it will go into the bloodstream, and even you can get a infection, the blood infection itself can occur. So any of this ulcer formation or the irregularities in the mucous membrane also can create problems. And when it comes to the anal part, the most important is piles. See, actually, the latest understanding is that the varicose veins, which is happening on the legs, and also for the men, this varicose seal of the scrotum, and the piles is also connected. The same, actually, it is the dilatation of the veins, the blood vessels, which is taking back the blood from the organs to the heart. It is getting dilated, and if it is dilated, and sometimes it may get the blood can clot inside that. That is why if the clot is happening, it can even produce pain, and also it can, there's bulges and this coming out whilst the severe form of fluence, there is clotting also happen, that is actually creating pain. So it is also related to food itself. So we can understand that anyone who is having pile or the pain at the anus or the abscess formation, fistula, fissure, all is connected to food itself. And even we can understand that most of these patients will be, those who are having piles can be, the chance of developing varicose vein also will be high. So it is not a part disease of the anus alone. It may be affecting other part, the other veins also, the whole body there is veins, it can also get affected. Next, when we come to the, when we think about the intestinal tract, we should think of the liver and gallbladder and the pancreas also. So any diseases of the intestine can, its first effect will be on the liver. And if the liver is affected, the gallbladder. Definitely, if you eat more, the stress of the pancreas and the liver is high. So if you don't have a nutritional deficiency, liver is the production unit. If there is a nutritional deficiency in your food, it is actually stressing the liver. And whatever it is imbalance in your food or the disease inside your intestine is directly putting an impact on the liver, gallbladder, and also on the pancreas. Next is cancer. We know that mouth cancer, oral cancer can come, and most of the oral cancer, there is a stage in which there are ulcer formation stage. It will be after a long time ulcer or a plaque or a thickening or something, then only it goes into a cancer. So if you are able to diagnose it early stage, you don't have to go for chemotherapy, the removal of the tongue or the part of the mouth or anything. If you are in the early stage, if you control your food and find out which is actually creating problem, the toxins in the food, the nutritional deficiencies, all these things are creating problem for and they are things which is making a mutation, that is genetic changes in the cells of the mouth. If it is in the mouth, problem is creating, it is mouth cells are damaging, and only after an accumulation of these changes, the control is gone, you are getting a cancer. So you don't have to go for it. Many will be worried if it is a cancer, so they will keep it quiet. No, you should understand that it in the early stage, if you give avoid toxins which is not good for your body, and give enough nutrient to correct this genetic damage, and our immune system will remove all these abnormal cells and make new cells, which is normal. So there will be enough, plenty of stem cells are there. They are not affected. There is no change in the genetic pattern. So they will be able to make new cells, provided you are able to give the sufficient nutrient. And also those patients with the ulcer, long-standing ulcer, gas problems. So after that only this stomach cancer comes. And there is a connection with the EB virus infection, that is called Epstein-Barr virus. So Epstein-Barr virus infection and the stomach cancer is connected, and also this Epstein-Barr virus has a connection with the blood cancers like lymphoma and all. So this sort of viruses comes into system, and they are also promoting the changes in the genetic mutation is promoted by the Epstein-Barr virus. So nowadays we are understanding more about the cancers, and we know that cervical cancer, the happening in the ladies' uterine cancer, it has a relation with the papilloma virus. Just like as many of we are finding out the relationship between this virus, which is actually introduced into your cell, into your genetic material. So they are creating problem with the genetic material and creating these cancers. And also the patients with the IBD, that is inflammatory bowel disease like colitis, Crohn's disease, etc., the chance of getting gradually developing into cancer is very high. And the problem is, another problem is, most of these patients, this is an autoimmune disease. So many is not actually controlling the food, not trying to find out what is actually creating problem. But we are suppressing it with medications like immunosuppressants, like steroids. So when you are giving steroids, the chance of getting infection and cancer is also high. So the disease itself and also the treatment is promoting the cancer formation. So what we had to find out, what is the reason which is making inflammation to the intestine, and try to remove it, and you can come out of, you can prevent the even the discomforts of the disease, and also you can prevent the development into a cancer. And another thing which is the large intestinal cancer, that is familiar adenomatous polyposis. That is for what we are actually doing every 5 years. I think in Western countries, we don't. In India, we don't have such a regular system. But in Western countries and all, every 5 years or 10 years, you do a colonoscopy and find out whether there is a polyp and remove that. But we should understand that even if you are having a familiar predisposition, if you correct your diet, if you avoid all the sort of preservatives, coloring agents, tastemakers, and minimize the toxins going into your system, and also minimize avoiding chronic medication. Even if there is a familial predisposition, it will not manifest. So if you have a familial predisposition for this adenomatous polyp, you are looking into every few years colonoscopy. It won't help you to develop progress of this disease. The real, if you want to prevent the progress of the disease, you have to control your intake of toxins. All the medicines you are taking for the this diabetes, hypertension, all these are actually irritating your intestine. Directly, it is irritating your intestine, and along with that, all the food additives. So we have to avoid that, and then you will be able to prevent this going into the cancer. That is applicable for the rectum, and also there is my large intestine, rectum, and also the anal cancer. That is the most common cancers of the intestine. Next is, what are the beneficial tests for finding out what is the problem with the intestine? Generally, when we have any abdominal pain, first is an ultrasound scan. So it will give an idea about the liver, stomach, spleen, and also the not only the gastrointestinal, the genetic organs also, like if in females, the ovary, uterus, and in men, the prostate. In so many, we get an overall understanding. And that is the first test, the scanning part of point. Next is the blood test. Actually, the inflammatory markers, if for the inflammatory disease, all these diseases are inflammatory in nature. Even the infection, autoimmune disease, allergy, all are inflammation actually. Even the cancer, that is another form of inflammation. So inflammatory markers like your blood count, DSR, HSCRP, CRP, all will be increased if or few of them will be increased. So we can find out these inflammatory markers in the blood, and also the cancer markers. There are the cancer before it manifests, even much before it is shown in the CT scan or even the PET scan or in the MRI. The cancer markers will be increased. The cancer markers for the intestinal problems is mainly CA 19.9, and some patients, usually CA 125 is considered as the marker for the ovary and the uterus and all, but it can also be increased. And alpha fetoproteins, that is mainly for the liver. And for the pancreas, there are other markers like CIFRA, and also this chronic pancreatitis. It can be actually after long years of chronic pancreatitis, only this cancer comes. This pancreatitis itself we can find out early by amylase and lipase. That is all these two are the digestive enzymes which is produced by the pancreas. And if it is seen in the blood in higher quantity, that means there is a leak into the bloodstream. There is an inflammation. So if you correct it that stage itself, you can prevent a pancreatic cancer. And also the insulin level. See, most of these patients, these type 2 diabetic patients, the insulin level will be high. Your pancreas will be producing so much of insulin. So any hormone which is in deficiency or in excess is it's not good for the body. So this excess production, and also what the medications you are using for the type 2 diabetes also is again pushing the pancreas to make more insulin. So this is actually creating problem for the pancreas. And it is actually hyperinsulinemia is problem not only for the pancreas, the whole body. It can create so much of problem for all the systems, because insulin is needed. And if the deficiency, like type 1 diabetes, there is a deficiency, that also create a problem for all body, all organs. Just like that, the hyperinsulinemia also is a problem for the whole organs, including the intestine and other cancer production, especially the pancreas also. And the other things we had to look into the LFT, that is the liver function test. The first impact is on the liver. So LFT can be done. And next, the other test we are doing is endoscopy. That is endoscopy, you can do the gastroscopy and also the colonoscopy. The small intestine part, it is not that easily approached through this colonoscope or the gastroscope. But this in first part and the last part you can see for the and also you can do the biopsy part also and see whether there is what is the histological changes happening and diagnose cancer and things like that. Next, everyone should have a broad idea about what is the treatment methodology for the gastric problems. So medicines, basically if an infection is there, definitely antibiotic will be helpful. And for the acidity, there are very effective medication to suppress the acid production. Like initially we are using this S2 inhibitors like ranitidine. Now there is proton pump inhibitors. They are much more effective than this initial S2 inhibitors. Then there is antacids are there. Then antiemetics, that is this for the vomiting, antiemetics are there. Then for the pain we are using the painkillers or the pain antispasmodic. Pain is mainly because of the action of the muscle contraction. Muscle, if there is irritation, the smooth muscles and the longitudinal muscles of the intestine will be contracting, and it is creating stress for the nerves, and you are feeling the pain. So there are relaxants are there, and that is called antispasmodics. Then there is for this IBD, that is irritable bowel syndrome, some sort of psychiatric medicines also used. See, there is psychiatric medicine is for irritability and for the brain. Same thing, there is an enteric nervous system is there. So some overactivity of the sympathetic or this imbalance in the sympathetic and parasympathetic activity. And the enteric nervous system is the problem for this IBD. So some sort of psychiatric medicines also used in the IBD. When we come to IBS, that is inflammatory bowel disease, the immunosuppressants, there is the inflammation is high. That is why there is ulcers and problems. So we are trying to suppress the infection. But like steroids and so many immunosuppressants are used. The problem is that is actually suppressing the infection. There is already ulcers and chance of infection is high. And in spite of that, you are suppressing the immunity. So the chance of abscess formation, that is, many of the Crohn's disease patients and ulcerative colitis patients, they're getting perforation of the stomach or the colon and all happening because of the immunosuppression, and the infection is proceeding. And also, so this part of patients, the cancer possibility is high because the treatment itself is promoting that. But we had to get symptom relief. There is no other way other than, the lifestyle correction and food correction the patient has to do. If the patient is failing, then we had to go for the medication only. So that is why in modern medicine we are giving immunosuppressants to decrease the symptomatic relief, but it can definitely give rise to give you other problems. And for the cancer, when it comes, the treatment is the removal of the cancerous part along with the lymph nodes. That is also immune system part. You are removing the organ itself and also the immune system associated with it. In the cancer, the first spread is to the localized lymph node, that is actually the supporting this immunological system. And then for the intestinal disorders, goes to the liver also, because the first it is taken to the liver. All the blood is going to the liver. The chance of getting secondaries. Actually, secondaries means liver is trying to remove that cancer cells, but they are failing it, and they start living there and multiply and attacking the liver also. When the intestinal problems, it is spread outside, that is, if it is reached third or fourth stage, then only the chemotherapy can help. And nowadays, after initially chemotherapy, then removing the part, and that way it is just like any other cancer, the first removal, surgery, removing the part, then the chemotherapy, radiation, and nowadays there is biological agents like immunotherapy also. That is also another sort of immunosuppression, or that is immunological modulation. This we are trying. When we treat another mode of treatment, that is fecal therapy actually. That also is in progress now. It is more acceptance and trial are happening. It is actually microbial transplantation. A patient who is having intestinal problems, you are taking the stool of a healthy human, and it is that microbes are separated and putting it into the intestine or the colon. That is either through the mouth, you are entering through a tube, it is put into this healthy microbes. So what is expecting is healthy microbes. The sick person is having the microbial flora is not in a balanced way. So putting a microbial flora into that is separated from the healthy person's microbial flora and inserted in that. That is called a fecal therapy or microbial transplantation for the intestinal problems. Now we have gone through the different aspects of the intestinal problems, and broadly we have seen the problems and the treatment. So we understand that there is a problem. If the problem happens, we have to get symptomatic relief. But we are actually going for the medication that is giving symptomatic relief. Or for many times, it is suppressing the immunity. But that will not solve the problem. So, yeah, the real problem lies in the food you are eating. There is a deficiency, or there is a toxins inside the food, or some of the food you are eating is not tolerant, your body is tolerating that. So the real solution is to find out what is the food which you are creating problem and avoid that, and to find out what is the real food which you can tolerate. It will be different for each person. So if a family member, 4 members are there in the family, only one may be getting the problem. So we had to identify that what is creating. All the 4 will be eating the same food, only one get the disease. But there can be problems in the running in the family also, because even this allergic or intolerant problems of the food is running in the family also. So we had to find out what is the problem and try to remove that. That is the absolute solution for that. And also, you should give correct nutrition, all the nutrition in the diet also. Then only that recovery can be possible. So that's applicable for not only for the intestinal problems, but it's for the all diseases. And the most important thing is all this autoimmune disease like Hashimoto's thyroiditis, IgA nephropathy, or the Crohn's disease, that is, it's happening in the intestine itself. all the people who is sick will be having some intestinal problem also. And it can be because of the disease itself or because of the medication it is taking. So when you take a medication, if you have an intestinal problem, if you have discomfort in the stomach, and if you are taking medication, actually it will be aggravating the problem. So for that, you will be again taking symptomatic relief for the again with the medication. So that is actually creating problem finally for the this inflammatory bowel disease and also for the cancers. If you have only minor problems like some gas or piles, you will be able to, if you are observant and if you use your intelligence, you will be able to find out which food is creating problem and you can avoid. And many this piles patients itself, they say, when I eat the chicken or the egg, I get the problem. And it may not be chicken or egg alone. There can be other food also. So we had to check, each person has to check which is creating problem for the particular person actually. It's the same gas also. We know that if you get a certain fruit or certain vegetables, it can create a gas or some other food. Actually, we will think always the vegetables and fruits are always harmless. Don't take it like that. It can also create problem. And also nowadays the leafy vegetables and the fruits are all laden with the toxins because of the preserving it and keeping it fresh. So much of chemicals are used. The fruit itself or the vegetable itself or the chemical used in that may be creating problem. So find out the problem may be difficult. Will be difficult definitely. But if you are intelligent, you will be able to eliminate some, find out and eliminate some. But if you are already sick, like you're taking immunosuppressants for the IBD, IBD or you're taking medication for the diabetes, hypertension, heart disease, all you're taking, then you won't be able to find out on correct your lifestyle or the food habits. Then you need some clinical support. In such patients, definitely you should look for a clinical support which is concentrated on this sort of clinically supported lifestyle correction sort of thing. Otherwise, it will be very difficult to. In clinically supported lifestyle correction, actually I am giving this clinically supported lifestyle correction. So in my experience, if the lifestyle correction is the food and finding out which is creating problem, and if you correct it, you will be able to come out of not only from the intestinal problems, all the other problems like type 2 diabetes. We are actually within a month most of the medications can be removed. That itself will give a lot of relief for the patient. Even the type 2 diabetes patient, actually they don't need any medication, only the diet and lifestyle control is needed. All these diseases are comes under lifestyle problems actually. So if your lifestyle is corrected, you can come out of the medication, and that is very important for the coming out of medication for the other disease also is very important for getting a relief from the intestinal problems. In brief, first understand that what we consume is converted as our body. The human body starts as a single cell which grows to an almost 3.5 kilogram baby utilizing the nutrients from the mother's food. Second, the 3 to 3.5 kg baby grows to a 60 or 70 kg adult with the nutrients absorbed by the digestive system and the oxygen absorbed from the lungs. Third, the most common cause of disease of the GI tract is the consumption of food that contains toxins or food that are intolerant to our body. This is why when there is a stomach or abdominal discomfort, it is important to recall the food taken, identify the trouble causing ones, and avoid them in the future. Fourth, all that is not a nutrient needed by the body, including the medicines, even nutrients in the excess quantity, are toxic as far as the body is concerned. Harmful biological agents like viruses, bacteria, alcohol, medicine, excess of starch, fat, chemical agents like my insecticide, artificial tastemakers, preservatives, all damages the digestive system. Fifth, our body is not alone. In our body, especially our digestive tract, has a whole lot of microorganisms. That we eat is not only for us, but also for those who live within us. Such microorganisms help in digestion, absorption, production of some nutrients like vitamin, and defending against harmful organisms as well. Sixth, the excessive growth of some microorganisms or a lack of them can negatively impact our health. Latest study shows the reason for many diseases is the imbalance in the ecosystem of the microbial organisms in our body. Seventh, these microorganisms living within us are a part of the defensive mechanism of our immune system, and they also should be protected, just like our other cells that make up our body. Eighth, excessive use of antibiotics, use of preservatives, chemicals associated with food, injure the ecosystem of the usual microorganisms within us and usually is the reason for a majority of gastrointestinal disorders. Ninth, the acid produced in the stomach is a major weapon of the body's defense system and immune system strength. Those who take medicine regularly to reduce acidity should know that they are in fact destroying the weapons of our body's defense system. 10th, today we consume so many food produced that were never consumed in human history. The excessive exposure of our body to foods that were never familiar to our genetic structure result in the diverse impact on the working of our immune system, resulting in the development of many diseases and disorders, especially autoimmune diseases and cancers. 11th, always remember, when you experience stomach discomfort, the digestive system should be given rest. This implies that those having digestive diseases should take special care to only consume in moderate quantities food of required purity that are aligned with our body. This information should assist you to understand and prevent lifestyle diseases, to help detect them at the earliest when present, and correct the lifestyle to reverse them. Also, it can be understood why medication and surgery cannot reverse such disease conditions. It is not the lack of medication or surgery that create the disease in the first place. This is why it is essential to understand how suitable lifestyle changes can only reverse these diseases and, more importantly, prevent their recurrence. Before any invasive interventions or surgery, it is essential to understand the underlying cause of the disease. What purpose does the surgery serve? The on-table and post-operative risks associated with the surgery, associated possible negative impact on future quality of life. This has to be understood not only by the patient but also the associated stakeholders, who are usually those who need to support the patient and share the consequences as well. Very often, there is poor understanding on whether the surgery provides recovery or relief, and whether the surgery prevents recurrence. Nowadays, health insurance is very common. This provides an opportunity to undergo surgeries without fear of any financial stress. This consumerist outlook guides many to be opportunistic and take advantage of the surgical options available primarily on the financial availability angle rather than on an overall picture. This is where the statistics that often provide us the huge percentage of unnecessary surgeries done on unknowing patients deserves maximum attention. Before every surgical intervention, the patient or guardian actually signs the document acknowledging the possibility of undesired consequences or even death from the intervention. This document of acceptance is to be read and understood before fixing a date for any surgical intervention. One should understand that any surgery is constrained by chronic lifestyle diseases, and if the advantage of reversing them with the lifestyle modulation before deciding on need for surgical intervention is considered carefully, it will be possible to avoid the need for a majority of surgical interventions. We need to be proactive in health and not wait for the disease conditions to reach a stage where we lose hope of the ability to actively reverse our health problems with a self-motivated lifestyle correction. Otherwise, we will have to remain an outside observer in the effort to recover health. Very often, never getting a clue of what the numerous healthcare partners are actually doing for your health. Very often, the core of improving body composition, metabolism, and immunity are never possible when you remain an outside observer, and this is what I hope will be the game changer for those who want health over conventional patient care. Another important aspect is when someone is talking about healthcare and newer treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Lifecarecentre, Thevara, Kochi. I focus on lifestyle modulation with the clinical support, minimizing medication and surgical interventions for lifestyle diseases. The focus was on understanding the effects of modern pharmaceutical drugs, surgical interventions, and physiotherapy on immunity. Based on the knowledge on the functioning of the immune system, developed nutrient formulas and body conditioning protocol named Oxyflex for optimizing circulation, stabilizing neuronal, hormonal, and immune activities. Optimized nutrition, along with the Oxyflex, is the foundation of the cell activation protocol, a clinically supported and supervised lifestyle modulation method for optimizing health, delay aging process, prevention and reversal of lifestyle diseases like diabetes, hypertension, heart disease, allergy, asthma, cancer, autoimmune diseases like thyroiditis, arthritis, psoriasis, etc. Thereby, reducing the need for medication and surgical intervention. Next, let us understand what is clinically supported and supervised lifestyle correction. Step 1 in this approach is to understand body composition and fatty tissue status to help determine desired body composition. Step 2 is to conduct laboratory tests to evaluate the health status of the organs of the body like heart, liver, kidney, pancreas, etc. Status of the system like circulatory, immunity, endocrine, metabolic, etc. and the compatibility status of food consumed or generally available. Step 3 is to identify what lifestyle modulations can help achieve the desired body composition. Patient-specific conditions will help decide on the effort at optimizing nutrition, physical activity, and the prevention of toxin accumulation. The focus is to create an enabling environment for the cells of the body to regain and retain optimum metabolic activities. When lifestyle modulations restores and retain optimized circulation, metabolic activities, hormone balance, immunity, and body composition, most lifestyle disorders can be overcome. When those who have been on medication for a long time and who have not reached the stage of irreversible organ failure are ready to modulate lifestyle to benefit from nutrition and help the repair and replacement of sick cells, protection from exposure to toxins, improved circulation through controlled physical activity, it is possible to prevent or overcome the vast majority of lifestyle diseases like diabetes, hypertension, angina, cardiovascular disease, allergies, asthma, arthritis, autoimmune diseases, cancer, etc. This also helps to avoid the need for medication and surgeries. Next, I'll explain the experience of treating few patients who are having intestinal problem. And in that, actually, most of these patients will be having other problems also, but I will be focusing on the intestinal problems mainly. So, this is a patient, she's 42-year-old and her height is 170 centimeters, a tall lady, and her weight is 75 kg. And her problem is she's suffering from gastric problems like she was diagnosed with the GERD and also Barrett esophagus. That is usually diagnosed with the biopsy diagnosis. She had undergone this endoscopy and all sort of investigations for this stomach problem. And this Barrett esophagus, it's a histological diagnosis, and the problem with that is the chance of getting an esophageal cancer or the stomach cancer is very high for such patients. She's only 42 now. She has given this proton pump inhibitor, and she's asked to take it continuously. Even if she don't take a day, she will be having much of the symptom problem. Otherwise, if she takes also, she is having problem basically, and too much of gas formation, acidity, and problems are there. And along with that, she is having other problems like disc prolapse is there, arthritis and disc prolapse is there, and her ITP, that is idiopathic thrombocytopenia, her platelet count is low. And on investigation, she is having hiatus hernia and also hemangioma of the liver. So multiple problems are there. And she was, after actually in the clinically supported lifestyle correction, what we do is special exercises are there to reduce the fat and content in the body. And if it is excess fat is there, she is definitely overweight is there. For her 170 centimeters with this diseases, she should be around 60 kg only, and she's having 75, so almost 15 kg excess. That is, excess is all fat. So what we are trying to give correct nutrition, it's a balanced manner, and special exercises which is in the lying down or sitting position, she can do it. And if you are correctly following, they will be able to get a 20% weight reduction along with a low calorie diet. And also the calories should be comes from the food should come from a patient should be able to tolerate. So special food is given which is made from minimal ingredients but ensuring all the nutrients. So actually within a week, her symptoms are corrected. She's throughout within the 8th day. Actually, we follow it up we follow it up continuously on the by telemedicine, so digitally, and also when the patient is asked to come on the 8th day, and again on the 15th day, and if the patient is locally available, then 30th day and every month till 90 days to 6 months. Next is when I didn't tell you about the investigation reports. Actually, her inflammatory markers were very high, that is CRP and HSCRP are high, and also she had some nutritional deficiencies, and she has already diagnosed with platelet count was low, that is ITP was there, and the iron content also was there. So many nutritional deficiencies and inflammatory markers were high, and only for the few weeks we are able to follow intensely. And also her she was allergic to many food like milk and milk product, groundnut, capsicum, and some food also. That is all individualized. I am not going into the details for that. So to understand that even for the patients which is diagnosed with this higher stress hernia and Barrett's esophagus and these multiple problems, and here back pain and the problems also is settled within 2 weeks itself. So when you correct the body, you're not getting the intestine also getting corrected. The whole body is getting corrected. Wherever is problem, you can get a relief. That is what I want to convey from this patient's case study. I'll go through another patient's treatment summary also. This is a patient who is 43-year-old and 171 centimeters height and 68 kg weight. And he is diagnosed with ulcerative colitis in 2018, and he is on medication for that. And along with that, he is diagnosed with this idiopathic lung fibrosis also. So he's taking medication for that too. And he's a diabetic patient for the last 6 years. And also another autoimmune disease, thyroid. He's taking this thyroxine because Hashimoto's thyroiditis, for that also he's taking. So see, there is 3 autoimmune diseases he is affected by. So many autoimmune diseases. That is like, it is like that. If one autoimmune disease, other autoimmune diseases can come. And the metabolic, because we are taking when this autoimmune diseases, you will be starting with the immunosuppressants, the steroids, then automatically the diabetes also will come. And he was undergone already cardiovascular diseases are there, and one stent is put on in 2020. And he is having arthritis problems, spine, disc prolapse, and he had taken this traction treatment and for that. So very anxiety disorder also is there. He's taking some medication for that too. See, once one disease, especially it is affecting the autoimmune disease, it comes, the other disease also follows actually. And for he was taking so many medications also with this intestinal problem. So it is all the medicines are irritants, and so but he is forced to take almost 14 type of medicines here. So along with that, thyroxine is there, Cellcept is there, mycophenolate, that is an immunosuppressant for this autoimmune disease, colitis, and also for the lung fibrosis. And Sonpras, that is for the intestinal, Mesacol, that is for the intestinal problem, this ulcerative colitis, that is Mesalazine. Then Ebiflo, that is Abrofilin, that is a lung relaxant, that is for the lungs, for the breathing difficulty. And prednisolone, that is also again an immunosuppressant. Then the cardiac medications like Conco, that's a bisoprolol, that's a beta blocker for the heart. Plagiarin, it is clopidogrel plus aspirin. So that is also severely written to the intestine, stomach especially. That is blood thinners. And the problem is, you should understand that he's taking blood thinner, clopidogrel and aspirin for the heart. But he's having colitis, and the chance of getting bleeding from the colon ulcers is very high in such a. He can go into severe bleeding also because he's on this medicine. And he's taking rosuvastatin and telecastif, that is more Delucas, Flavoxamide. Rosuvastatin for the cholesterol, and the telecast for the two medications for the allergic actually. And some other Syncoate, vitamin D3, calcium max, omega 3, and other things, and also homeo medicines. He's trying all these medicines actually. And the result actually with the clinical is about a lifestyle correction, that is with a special food and special exercise only. We were able to reduce the medicines actually. By the diabetic medicines, we stop in the first day itself. And the other medication, actually his HbA1c was comparatively under control. Actually by coming here itself, he has controlled his food, and he is himself stopped the diabetic medicines. And here HbA1c was 6.3 only. So that is many of the patients who are after seeing this sort of videos, they try to correct their diet, and they are able to reduce the medication in many cases, and also the discomforts also. But this person was able to come out of his diabetic medicines and with reasonable control. But he needs other corrections also. And by the 8th day, his medication was reduced to 17 tablets, reduced to 11. And his HbA1c was come down 6.3 to 6.1 without medicine. And also day 15, his HbA1c was 6. And his medicine was again reduced to 10. And by 30 days, his medication was only 8 tablets further. And his HbA1c came down to 5.5. And by 60 days, he was actually symptom-free by the 8th day itself. He is symptomatically free. But his medication was there. We cannot stop all the medication all of a sudden. We can have to gradually withdraw, because he's on so many immunosuppressants and all. So only gradually we can reduce the medicines. And by the 60th day, it's only 10 medicines, and 90th day, only 6 tablets. And by 180, he is able to come out of almost all the medicine. He is taking only this, if he get a discomfort, he's an anxiety patient, and he was given a beta blocker, small dose of 10 milligram propranolol. If he get an anxiety, because along with the work and all, if he's had a problem, he's taking that. Otherwise, he is symptom free and medicine free. And here also we should remember that he was on so many medicines. And even the breathing problem, the lung problem is gone, the stomach problem is gone. So it's all through the dietary modulation that we should, that is the most important aspect. So those who are patients, I want to convey this case study, because everyone knows that such disease, so much of disease, they will be on medication and adding medication, and the discomforts will be. But if such patients also can come out of medication and out of discomfort. Another patient is, I'm telling it for an example for the early cancer detection and how to reverse the problem. This is a 78-year-old man his height is 167 centimeters and weight 72 kg. And he is diagnosed with the cancer of the it's a tumor of the bladder. It's a papillary lesion of the bladder, and surgery was done in 2022. And he is pre-diabetic. He's not on taking any medicine for diabetes, but his HbA1c was 6.2 and insulin level was high. Around 90 was there, and the pancreatitis, lipase was high, and his kidney function was reduced. GFR was 77, that is grade 2 renal failure is there. Yes, we should understand that he is 78 years also, and his HSCRP, that is a cardiac marker actually, that is high, ESR is high. He was actually diagnosed with the fatty liver and liver problems also. That is one of the reasons for he to think of lifestyle correction. And that is he's having fatty liver, and also his liver enzymes was high. His SGPT and SGOT is high, and hemoglobin and blood count is RBC count all is low. And there is a autoimmune antibody, AMA is positive also. And the most importantly, his PSA is high, and also CA. CA is a marker of the intestinal tumor. Intestinal cancer is the marker for that, this PSA. So, usually if it is done, you go for a colonoscopy and such things. Actually, we are after starting his lifestyle correction, he is able to come out of the diabetes. Actually, the 8th day itself, his HbA1c came down from 6.2 to 5.9. And his by 15th day, his HbA1c was 6. And by 30th day, it was 7.5. And 60th day, HbA1c came down to 5.5. And also, the renal function and from 77 GFR to it increased to 87 by day 30, and by day 60 it was 93. That is, recovery was complete by the day 60. And the liver function, the SGPT, SPT were high. So that has come down to normal by the 30th day. And by 15th day, usually we check in the 15th day, it was come down, the enzymes was come down, SGOT, SGPT come down. And by 30th day, it has come normal. PSA has come down to normal by the 15th day itself. But the PSA, it took some more time for PSA to come down. And actually PSA got corrected only by 60th day. So AMA, that is autoimmune antibodies, was also came down by the but the 90th day, AMA also has come down to 57 only, but it is not fully normalized. So what I want to convey in this, and this is a person is already prone because the bladder tumor was there, and along with the 2 tumor markers were high, and it all came down with the diet and exercise alone. And he was not overweight, but he has come down his weight also. It's very important. His fat percentage was actually initially it was 27.2%. For the men, only 15% is the ideal. 10 to 15 is the ideal. And he came down his weight also to 62, almost 5 kg reduction in the 90 days. And by the time his fat level also reduced to from 27 to 21%. So that is the important. Actually, we are trying to increase the muscle and bone mass. That is actually giving you strength, and reduce the fat mass to almost all the patients, the sick will be having excess fat in the body. So that has to be also reduced because the fat is controlling your immune system. This is very important to know that. One more patient, her major problem is gastritis. Actually, the endoscopy shows pan-gastritis, and also she's having piles, recurrent attacks. Along with that, she's having arthritis and allergic symptoms is also there. Sinusitis, recurrent sneezing and respiratory infection, and migraine. And this is also, migraine is also having close relation with the food we take, and varicose vein. So multiple problems. It's all for the clinic. This all this comes under lifestyle disorders only, and she is taking symptomatic measures for the treatment are there, and this actually, and she's taking some proton inhibitor and also some homeo medicines also. She had tried the Ayurveda, multiple sort of medications she tried, and finally she wanted to try this. We check for the, because her major problem is she's not able to take much of the food, and wanted to find out what all the food is creating problem. And in the test actually her immune system is reacting to many common food like dal chana, that is a very common food in Kerala diet, and capsicum, cashew nut, cardamom, that is a spice we commonly used, and vinegar, chicken, and so many food items itself is reacting with her, and the milk, and even walnut we consider as a good food with high omega-3, and she's reacting to walnut also, and antibodies are there for against walnut. Egg white is very high reaction, and the common staple diet here, rice, she's allergic, and also wheat, and so many items, potato, so many items she's allergic to. I'm not going into the details because it will take a lot of time. So it is individualized, and she is asked to avoid all these things and given special food which can to ensure that all the nutrients are there in the food. Actually, she's a 37-year-old lady and 156 centimeter height and 52 kg. And she's having varicose veins also for the last 17 years, and darkness. That is another, I'm not going into those things actually. She has, because it will take a lot of time if you are discovering all the details. So she was actually able to come out of symptoms. By the 15th day itself, she's reduced, all her symptoms are reduced. Again, in the 15th day, she's almost comfortable. By 30th day, she's totally okay. And she is able to reduce her weight also. Excess fat was there. One more treatment experience, that is, this patient is having, her major problem when she's coming is scleroderma affecting her esophagus. So she had undergone biopsy, and she's having difficulty in swallowing. So they are undergone biopsy, this endoscopic biopsy, and it is diagnosed as a scleroderma affecting the esophagus, and dilatation was done. And she is having other problems also. She's having suffering from arthritis and idiopathic lung disease. That is another autoimmune disease. Actually, scleroderma is an autoimmune disease which can affect any part of the body, and unfortunately her lung is affected. Her esophagus also is affected, and she's weight loss. She's actually 158 centimeter. She's a 62-year-old lady, 158 centimeter height, and her body weight is only 38. And she's taking so much of medicines, many medications, and and fatty liver. On investigations, fatty liver is there, and also GERD is there. GI gastrointestinal problems, acid reflux is there, gas is there, and she's not able to take any food. That is the major problem for her. As the swallowing is difficult, and he cannot tolerate any food. So naturally the weight will be come down. Actually the last 6 months she is saying that drastically reducing. And she's on so many medicines, especially the immunosuppressants, Mycept, that is usually given for this lung problem. Mecofenone, it's an immunosuppressant, and Omnacotil, another immunosuppressant, is prednisolone, and domperidone and esomeprazole, that is for the gastric discomfort, symptomatic relief, and also sildenafil. Actually, it is also given for pulmonary hypertension. That is usually initially it was all for the sexual dysfunction we are using. I think it has some vasodilatation effect is there, that is to be tried her for the sildenafil citrate is given for 20 milligram for twice a day. And she's having nifedipine also. And also she's taking sintilimab. It is actually, its names are all funny. So it is actually of protein inhibitor sort of thing. It is also usually used in the as an immunosuppressant and immunomodulator. It's an immunomodulator. And also for metoclopramide, she's taking one tablet every morning and evening for nausea and vomiting. See how much gastric problem is there. And also she's taking inhaler. That for the she's breathless also. So much of problem, gastric problem is there, breathing problem is there. Next, what are the benefits she got by so many problems are there? What is the outcome of this clinically supported lifestyle correction? Actually, she was also on her industry, her immune system was reacting to so many food items like egg, milk, even many pulses. But she was not allergic to rice. Actually, the Keralite, the most important is the rice. If they find it allergic to rice, then they'll be so much depressed. But she's not allergic to rice, but she's allergic to wheat. She's living in North India, and her staple diet was actually wheat. But he cannot take wheat, but it's okay for her, the rice. And so many other. I'm not going into the detail. But anyway, with our treatment, she was not able to take even the food support we are giving, because she is having difficulty in swallowing. So even it is only liquid diet. It's in a powder form, and you can make it as syrupy or a drink actually, and she can take it. But even though that also she was finding it difficult in the initial stages. So the result also was it's gradual, the symptomatic relief. But she has tremendous symptomatic relief. It was like if we consider it as cough and discolor, this symptoms at 5 plus, almost all the symptoms like a severe cough, acidity, breathing difficulty, everything initially in the 5 plus actually, and it just reduced to 3 plus. It's not completely gone by the 15th day, and by the 15th day it was 1 plus, and only by the 30th were only symptom was constipation. And initially he was taking 7 type of medicine and 9 tablets. And from the 8th day she's taking 3 type of medicine and 5 tablets. And then that also that many of the medicines, even the tablet number is there, the dose is reduced. And by the 15th day, 2 types of medicine and 3 tablets. And by the 30th day, only 1 tablet. And that also released by the 60th day, she was able to come out of all the medications, the regular medication. You should understand that it is not a simple disease, and it is if some modern medicine doctors is hearing it, they will not believe it. It is actually, it's impossible. From a modern medicine point of view, thinking that so much of medication, so much of disease, and the patient's symptom is reducing and medicine is reducing, no one will believe, because it is impossible. But it is real if you are willing to correct your lifestyle in a systematic way. You will be able to come out of your diseases And also she was able to gain weight also. When she came, she was only 37 kg, and she was by the end of 90 days she was able to increase her weight to 42 kg. But that is with an intestinal problem, and she is not a very good patient, because she is not following everything that correctly. But even you follow 50 to 70% itself, you will get result. So almost 5 kg gain also is there, and symptom free and comfortable. So maintain this sort of patients, they should maintain also their lifestyle, which after correcting this, they cannot go back to their old food habits or the color and preservative things and such things. They should not go. They should maintain their lifestyle in a healthy manner. The focus of clinically supervised lifestyle modulation is not on the symptoms. Focus is on the lifestyle parameters to be corrected to set right, the undesired variations in the body composition, hormone activity, circulation, immune status, etc., which are at the root of one or more lifestyle diseases. This explains why patient can simultaneously get relief from multiple diseases, multiple symptoms, and multiple discomforts. We should understand that the basis of recovery from diseases is the self-healing power of the immune system. The goal is to create the optimal environment for the immune system to stimulate this self-healing power. Everyone should try to self-modulate their lifestyle to optimize health. When this is not possible, or when suffering from a serious condition, or when suffering from multiple disorders, or taking chronic medication, or suffering from the ill effects of chronic medications, or when the surgery is under consideration, the need for clinically supported and supervised lifestyle modulation becomes necessary. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, the treatments with the emphasis on the benefits of lifestyle correction from the website and YouTube playlist. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding the symptoms, current diagnostic methods, and treatments along with the benefits and side effects. Practical aspect of the lifestyle self-correction, and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical, and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. Thank you.